Hello, everyone. Welcome to Lump TCM and Acupuncture Basics. We are now on our 45th episode. Welcome, everyone. Let's welcome our first presenter, Sardino Pinheiro from Legazpi. Good afternoon, Sardino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with lump basics, the Qi deficiency. So we have here the illustrations, Qi deficiency. If we could observe very carefully, pantay-pantay po yung blood, yin and yang, and pababa po yung sa Qi. So illustrating that there is a Qi deficiency. First, Qi deficiency could cause poor circulation. This may be because of poor function of the spleen or stomach, causing retention of food or stagnation of mucus. Or it could be retarded heart function, resulting in stagnation of blood. Secondly, Qi deficiency could cause poor elimination function. If the kidney function is affected, this could cause water retention, the thin fluid. Number 3, Qi deficiency could cause poor absorption or blood building function, malabsorption syndromes with malnutrition or poor function of blood synthesis resulting in blood deficiency. So dito sa illustration, ang Qi deficiency could result, number 1, magkaroon ng excess ng blood, or meron siyang food or mucus retention and blood stagnation. Number 2, excess yung yin, nagkakaroon ng water retention. And number 3, mababa yung blood, mababa yung qi. So nagkakaroon ng malnutrition and blood deficiency. So common symptoms and treatment. Sa symptoms of poor function, meron siyang poor circulation causes stagnation of fluid, excessive mucus, edema, fullness, heaviness, poor function of elimination causes retention. Meron siyang constipation, water retention, edema, keeping in emotions such as sadness or anger. So sa treatment, improve function, remove stagnation, Bakshu point of organ, needle and cupping, plum blossom tapping at the back of organ, and use of blue connecting point of young organ. Sa poor function of blood building causes anemia, paleness, tiredness, poor endurance, poor memory, and sleep, easily sleeping hands and legs, blurred vision. Sa treatment is to improve function of blood building, all points above except blue point of organ. Add move front point of affected organ or tonify the yin of organ. UB15, REN14 to tonify heart, UB17, spleen 10, GB39, and iron. Sa poor function of holding and firming causes incontinence, slow bleeding, bruising easily, spotting, and gum bleeding. Sa treatment, we use spleen 1, moxa, against slow bleeding. Tonify yin and yang of affected organ. General advice against stagnation: drink thin, warm fluid, eat unrefined grains, eat cooked and warm food, eat less food in the evenings, use pastel colors in the living space. So thank you po for your attention.
Thank you very much, Sardino. Let's continue with pulse diagnosis and overview. Okay, let's take a look at the figure. So as you can see, we divide the positions into 3: upper warmer, so middle warmer, lower warmer, platoon, 1, sure. This is a typical pulse of a patient with endogenous depression. So as you can see, the pulse in the middle, at the middle position, is very, very, shall we say, very impactful. This patient has morning anxiety, loss of appetite and libido, insomnia, feeling cold, lack of joy. She has problems with concentration, poor memory, and is weepy for no apparent reason. So this is practically the pulse that you will be able to notice much. Okay. And her upper warmer pulses on both hands, as you can see at the distal position, the tsun, they are very empty and weak. This shows that her heart and lungs are weak. Tonifying the heart and lung, front mu and back shu points, and giving the pericardium 6, the distal point for the thorax, will improve her upper warmer energy and will lift her depression. After judging the fullness in the 3 warmers and bringing this closer to balance, it would be useful to take a look at the pulse qualities in general. There are some 28 pulse qualities, and the author doesn't feel that it's important to know them in detail and expertly in order to practice good acupuncture. But it is important to know what to look for in these pulse qualities. So the author has tried to give us the 5 important aspects that we need to concentrate on when feeling the pulse. Thank you very much for listening. We listen once again to Sir Dino Pinheiro for the next topic, still on questions to ask the patient. Sir Dino?
Okay, good afternoon, Doc. Good afternoon po sa lahat. We continue with lung basics, questions to ask the patient part 2. So, here sa sleep problems, ang patient natin merong insomnia. Kung observe natin yung tower diagram, excess po yung yang. So, heart yang excess, this one is acute. Ang second po is deficient yung yin, pero still excess yung yang. So, we have heart fire and dry heat. Meron siyang subacute or recurrent. Ang third tower diagram, deficient po yung yin, normal yung yang. So the patient is heart, blood, and yin deficiency. This one is chronic. Ang fourth tower diagram, deficient po yung blood, ganun din po yung qi. So there is blood and qi deficiency. Ang condition is chronic. Yung next tower diagram, deficient ang yin, excess po yung yang, so empty heat with yin deficiency. Ang condition is meron siyang dream, disturbed sleep, and nightmares. Ang last tower diagram, deficient ang yin, normal yung yang, so there is a kidney yin deficiency. Ang condition is problems with falling asleep. Sabi niya, my body is tired but my mind is busy. So next tower diagram, deficient ang yin, normal yung yang. So there is a heart yin deficiency. The condition is problem sleeping with through the night. Deficiency time of organ according to organ clock, tonify the yin of organ. Waking up at night at a particular time and not able to fall asleep for 2 to 3 hours. Next tower diagram, equal po yung deficiency ng blood and qi. So there is a heart, blood, and function qi deficiency. So meron siyang early waking with worries or anxiety. Next tower diagram, excess po yung yin, deficient yung qi. So there is a heart qi deficiency, yin rises after excess sleep. So meron siyang hypersomnia, feel sleepy all the time, low alertness, not better after sleep. Sa last tower diagram, there is a yin deficiency, normal yung yang. So the patient is heart yin deficiency, meron siyang needs much sleep to feel energetic and awake. Sa treatment for insomnia, we use tranquilizing points like do 20 extra 6, good night points, yung 1, PC6, UB62, add the following points to the above. Sa heart yin deficiency, meron siyang gagamitin natin yung REN 14, move front point. Also, heart 8, the house element point. Pag ang patient merong heart fire, we use heart 5, the loop point, and sedation of small intestine 4, the U1 source point. Pag ang patient merong heart blood and chi deficiency, we use REN 14, UB 15, the shoe point, heart 9, small intestine 3, UB 17, the influential point ng blood, spleen 10, the sea of blood, GB 39, influential point sa marrow. Pag ang patient merong kidney yin deficiency, we use kidney 7, the tonification point. And pag meron naman heart yin or blood stagnation, we use UB 15, the back shoe point, SI 7, the loop point, and kidney 6, wake back point for hypersomnia. All the above problems are primarily of the upper warmer, but it is also possible to have rising yang from liver, stomach, or kidney to the upper warmer, producing similar symptoms as heart yang excess. In these cases, spleen 6 with descending needle technique would be a good treatment in order to descend the ascending heat from other organs. Thank you po for listening.
Thank you very much, Sir Dino. So let's continue with the earth element. Still on diseases and symptoms. Okay, so first, let's try to review the functions. So as you can see here, the spleen and the stomach. The stomach receives, digests food and drink. So if you have spleen, blood, and chi deficiency, there will be no hunger, appetite, or eating much, but there is weight loss. Malnourished, tired, sleepy after eating. So if you have spleen chi deficiency, there is less hunger and thirst, prefers hot food and drinks, dislikes cold, long emptying time. So damp cold in the spleen, there is less thirst and hunger, great appetite, likes extreme flavors and temperature and fullness. So if a person has burning pain, colic, and vomiting, and the diarrhea is worse after food, coupled with gingivitis and blepharitis, so that's that damp heat in the spleen. Okay, if a patient has small appetite, but great thirst, often hungry and weak, so that's empty, dry stomach. If a patient is often hungry and intolerant to hunger, with hyperacidity, acid reflux, better after bland food, the patient has stomach fire. Dull, constant pain in the stomach in the mornings, no hunger or thirst till 11 a.m. The stomach is heavy as stone after meals for a long time, so that's cold stomach. Spleen absorbs and distributes nutrients. So if one has malabsorption diarrhea, type 1 diabetes, thin and undernourished, so that could be spleen blood deficiency or spleen chi deficiency. And if one has undigested stools, type 2 diabetes with polyneuropathy and numbness in the periphery, that's spleen chi deficiency. If the patient is obese with fat torso but smaller extremities, with type 2 diabetes, edema, and numb hands and feet, semi-solid stools, there's damp cold in the spleen. If the patient has pancreatitis, parotitis, lymphangitis, so there's a lot of heat and dampness, it's damp heat in the spleen. If emptying is easier with fluid foods, so you have an empty, dry stomach. The food moves up, not downwards, better with bland foods, so that's very stomach fire. Emptying very slow, better with smaller portions, warm and cooked food. That's cold stomach. So there is a preference for warm food and cooked food. Next, the spleen circulates blood and fluids. So we have problems like if the patient has problems like cold extremities, can have some edema, poorly healing wounds, edema of the eyelids. So that's spleen blood deficiency and qi deficiency. Cold extremities, edema, numbness of extremities in all three, edema of the eyelids, that's spleen qi deficiency. So if one has edema with stiff joints, heavy limbs, edema on the face, that's damp cold in the spleen. I hope you're trying to visualize the picture of the patient, the profile of the patient, as we read along. Hot and swollen hands and feet, that's damp heat in the spleen. If the patient has dry hands and feet, cracked or peeling, so there are people with cracked soles on the feet, no? So that's empty, dry stomach. Extremities, hot or cold, depends on dampness. More damp, more heat, so that's stomach fire. And if this with cold extremities, with cold center, that's definitely cold stomach. And lastly, we have the spleen or stomach open to the mouth and lips, secrete saliva. So if one has pale lips, salivation may be diminished sometimes and increase sometimes. So there's issues about salivation. So that's spleen blood deficiency or spleen qi deficiency. So with spleen qi deficiency, the lips are pale with thick saliva. If the lips are large, pale, or purple with excessive salivation, so that's definitely damp cold in the spleen. Next, we have parotitis, pain or discomfort during salivation. That's damp heat in the spleen. Dry mouth, dry, cracked, or peeling lips. I think I can relate to this. The peeling lips, damp heat in the spleen. Dry mouth, dry mouth. No, that's empty, dry stomach. I'm sorry. Dry mouth, dry, cracked, or peeling lips. Empty, dry stomach. At least hindi pa stomach fire. With stomach fire, there's dry mouth with bitter taste, red inflamed lips. And finally, with a cold stomach, large pale lips, excess salivation in the mornings. Thank you very much for your attention. Let's now call on Ma'am Lynn Galarita for topic number 5, still on therapeutic methods, part 6. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. So last time we discussed about clearing the fourth method, or the fourth therapeutic method. For today, we'll discuss about ascending. So what is ascending used for? This is to raise yang qi and lift zhangfu organs from sinking. This is also for failure of ascending pure yang and sinking of qi in the middle energizer. Prolapse must be treated by ascending method. Ptosis must be treated with moxibustion. Qi descending from the upper portion must be corrected by pushing it up. Clinically, acupuncture with reinforcing method plus moxibustion is applied to local points in combination with GV20 or Do20, CV6, CV4, and stomach 36 to treat dizziness and vertigo due to failure of pure yang in ascending, sinking of qi in the middle energizer, visceroptosis, prolapse of rectum, and prolonged dysentery. So now let's discuss on the points used in ascending. First is Do20. This point, there's a precaution in using moxa if a patient suffers from high blood pressure. So it's not advised to do moxibustion on GV20. This point calms and relaxes. So GB20 is located on the midline of the head, halfway between the frontal hairline and the vertex of the external occipital protuberance. Needling is done through transverse insertion, either front to back or left to right, 0.5 to 1 tune. Sensation of local distension and pain could be expected. Extreme care should be taken when using this point on infants, because fontanelles have not completely closed, or on patients with hydrocephalus. Next point is CV6, or the Sea of Chi. This point is very important for tonification. It's also the center of energy for the whole body. It's located on the midline of the lower abdomen, 5.5 tune, 1.5 tune inferior to the umbilicus, and 3.5 tune superior to the pubic symphysis. Needling is done perpendicular, 0.8 to 1.5 tune. Caution should be observed with deep needling may penetrate the peritoneal cavity. It is contraindicated during pregnancy. Next point is CV4, or the gate of origin. This point is a powerful point to tonify chi and blood and to strengthen body and mind. It is 3 tune inferior to the umbilicus on the anterior midline. It is needled perpendicularly, 0.5 to 1 tune, or with an oblique insertion directed inferiorly, 1 to 1.5 tune. Caution should also be observed, as deep insertion may penetrate a full bladder, which should therefore be emptied first before treatment. Next point is stomach 36. So pag mapapansin natin, mula pa dun sa first therapeutic method, sa reinforcing and then reducing, warming, clearing, laging present, stomach 36, and now sa ascending, stomach 36 is also used. Clearly, this point is a very important acupuncture point. And it's the most important point to stimulate actions of the stomach and spleen to generate chi and blood. Again, as a review, this point is located below the knee, 3 tune inferior to stomach 35, 1 finger breadth lateral to anterior crest of the tibia. We can also locate GB34 first. So we find stomach 36 which lies 1 tune inferior and 1 finger breadth lateral to the anterior crest of the tibia. Or we just locate 1 hand breadth below stomach 36, and that's at stomach 35, so that's stomach 36. Needling is done through a perpendicular insertion, 1 to 1.5 tune. So in general, ascending method is not for patients with yin deficiency and yang hyperactivity. That caps our discussion on ascending. Join us again for the last part of the therapeutic methods next time. Thank you for listening.
Thank you very much, Ma'am Lynn. Okay, so we shall now proceed to the next topic. Let's call on Sir Dino once again for Controlling Cycle, Part 8.
Okay, we continue again with lump basics, controlling cycle, Part 8. We have here a clinical example, scar blocks of a male 56 years old. A man suffered from insomnia, tinnitus, and restlessness, and could not relax even when he was very tired. He was not a smoker, but he required a drink of whiskey to help him fall asleep. He would then wake up in about 2 hours, or when the effect of the alcohol has passed, and was again restless. He had these symptoms for the last 4 years or so. On examination, the above patient was found to have a scar on the Ren meridian between the sepoid and navel. When asked about it, he mentioned a perforation repair of a stomach ulcer 5 years previously. This small finding has a tremendous effect on the diagnosis and treatment prognosis. The scar on the Ren meridian, the most yin meridian of the body, blocks the yin from coming to the upper part of the body. The upper part of the body lacks yin to control its yang. The yang has a tendency to rise to the upper body, and the patient now did not have enough yin to control the yang. As a result, we have the yang dominant symptoms of restlessness, insomnia, and tinnitus of a kidney yin deficient type. So sa treatment, the patient was treated with symptomatic points such as DO20, Good Night, PC6, UB62, and Liver 3, and this scar was So here, the Ren meridian, yung nasa middle, and we use 6 needles to unblock the vertical scar on Ren meridian. Okay. So thank you po for your attention.
Thank you very much, Sir Dino. We now call once again Ma'am Lynn Galarita for Meridian Theory. Hello, Ma'am Lynn. Good afternoon ulit.
So now let's continue exploring the gallbladder meridian of Foot Lesser Yang. We're on the part 3 on this topic. So let's start with GB30. This point is located with the patient lying on their side. The point is at the junction between the medial 2/3 and the lateral third of a line connecting the trochanter and the sacral, the greater trochanter and the sacral hiatus. This point is called the point for the longest needle. As we can observe, it is located in the buttocks, so this point is quite deep. That's why needling this point may be around 2 to 3 Chun perpendicular. It is a useful point to treat hip and back pain, and there is a very good reaction with hot needles on this point. Next point is GB31. On the lateral aspect of the thigh, inferior to the greater trochanter, approximately 7 Chun proximal to the popliteal crease. This point is the wind eliminating point for hip and leg. This is a good point against itching, allergic reactions, and pains moving up and down the leg and hip. This should also be used with the wind elimination technique. Next point is GB34. It is located in the depression anterior and inferior to the head of the fibula. This is the influential point for muscle and tendon. It is used in all problems of the locomotive system and in paralysis, tension, etc. Next point is GB36. It is 7 Chun proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula. This is the left point of the gallbladder meridian. It is an effective point for quickly relieving gallbladder pains or migraine headaches. Next point is GB37. It is 5 Chun proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula between the peroneus longus and extensor digitorum longus muscles. This is the luo connecting point of the meridian. It is used to tonify the yang and reduce the yin at the same time. It is a very effective point in the treatment of long-sightedness with special difficulties with night vision. It is also a good point to promote elimination of bile and remove stagnation in the gallbladder. This point improves the free flow of thick fluids in general, and because it is the yang coupled organ of the liver, it promotes free flow of blood in the blood vessels. It is an anti-cholesterol point. Next point is GB38. It is located 4 Chun proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula. It is the sedation point and the 5 point of the gallbladder meridian. It is 1/4 the distance between the popliteal fold and the prominence of the lateral malleolus, which is a 16-tune line. This point should be located using proportionate measurements in order to be accurate. So this is all for now. Thank you for listening.
Thank you very much, Ma'am Lynn. We now come to the last topic for today. We're still on chronic fatigue syndrome, the Western medicine concept. In support of the theory, Western medical people are already looking at the viral origin of chronic fatigue syndrome. So elevated neutralizing antibody titers against Coxsackie B viruses were detected in 50% of patients suffering from CFS, compared with 17% of healthy controls. This is statistically very significant. Coxsackie B virus specific immunoglobulin, IgM, indicating, so when you have elevated IgM, this indicates a recent or persistent viral infection, was detected in 31% of patients compared with 17% of healthy controls. Virus-specific IgM responses were detected in sequential sera from CFS patients over 1 year or longer, suggesting persistent viral infection. Cunningham, Bowles, and Arshard studied muscle biopsy samples from a total of 140 patients suffering from CFS, of which 34 or 24% were positive by molecular hybridization for the presence of enterovirus RNA. This is a highly significant finding, as enterovirus RNA was not detected in any of the 152 control samples of human muscle. In a series of 96 CFS patients, 20 or 21% were found to have biopsy samples positive for enterovirus RNA. The duration of the disease among the enterovirus positive group ranged from 2 months to 20 years and indicates that enteroviruses are capable of persisting in muscle for many years. Other researchers directed the research more towards the Epstein-Barr virus as a possible cause of CFS. The Epstein-Barr virus is a ubiquitous pathogen with which most of the population becomes infected subclinically during childhood. So hindi masyadong pinapansin. If primary infection occurs during adolescence, infectious mononucleosis, glandular fever usually results, and it may last for several years. Several studies of patients with symptoms of CFS found serological evidence of persistent Epstein-Barr virus infection, irrespective of a clinical history of infectious mononucleosis. Interestingly, there was no obvious clinical feature that distinguished these patients from those diagnosed as having CFS due to an enterovirus infection. This is a real difficulty in Western medicine, as one cannot have a clinically defined disease being due to two different pathogens. It is this difficulty that leads many doctors to deny the very existence of CFS as a disease. Several studies have shown that the incidence of antibodies against enteroviruses or Epstein-Barr virus antigens is greater in patients with chronic fatigue than in controls. Nevertheless, in symptoms of CFS may be caused by different viruses, and since there is no conclusive blood test that is indicative of CFS, because healthy subjects may present the same evidence of viral infection, it is difficult for the medical profession to grasp CFS as a disease. In 1988, Mowbray and Youssef published the results of a new sophisticated blood test for CFS called the VP1 test. The test picks up a specific protein called viral protein 1, or VP1, which helps to form a protective wrapper around the virus. VP1 is common to all 72 types of enterovirus, and the results with CFS patients turned out to be positive in 605 cases. However, the fact remains that although enteroviruses remain the most consistent group of viruses associated with CFS, there are many cases when the illness follows infections with other pathogens, such as herpes zoster or the shingles, varicella, chickenpox, rubella, German measles, and cytomegalovirus. In a few cases, CFS follows immunization. Thank you very much for joining. We hope that you can join us again next time. Thank you very much.